Surely all of you have seen people sitting around an opium session consuming opium, whether they're doing it alone or in a group, and they seem to be in such a strange state, so absorbed and engaged in what they're doing, that you might think they're experiencing the most pleasurable thing in the world. And when you sit down to talk with them, without exception, they all talk about the beneficial effects of opium. They mention the benefits it has had for their bodies, the pains it has cured, and the problems it has solved. To the point that you might think opium is a super medicine, a panacea that cures all the world's ailments. But is this really true? And is opium actually beneficial for the body, or is it harmful? In this video, we want to talk scientifically about the cardiovascular side effects of opium based on the latest global guidelines. So stay with me. Hello, I am Dr. Habibi, cardiologist. In this video, we want to talk together about the cardiovascular side effects of opium. What is opium? Opium is derived from the poppy plant and contains various compounds, the most important of which are morphine, codeine, and some other opioid compounds. According to official statistics, we have about 3 million opium users in the country. But based on my own estimates as a doctor, that is, as a cardiologist, the actual number is even higher. Because in the hospital, especially in the angiography unit, where patients with heart attacks are admitted and it's a matter of life and death, it's the last line of defense. In other words, when patients come there, they have to give us the most complete information possible. They absolutely have to reveal everything, because any medication we might potentially use or any medical procedures we perform could seriously interact with their overall health and could profoundly affect the patient's lives. That's why many patients there give us accurate information, and based on my estimation of the middle-aged male population, that is middle-aged men and older, out of every 3 people we ask, one of them says they use opium. Therefore, I believe that the actual statistics are much higher than what is officially reported, and because of the social image associated with opium use, many people hide it. And unfortunately, these days we are seeing that even among women, opium use has become common and is on the rise. So this is an important problem, both socially and in terms of public health, that we need to pay attention to. The next issue regarding opium use is genetic predisposition. That is, those who turn to opium or other drugs. This desire exists within them. In other words, I look at myself. Not only in my immediate family or first-degree relatives, but even when I look at more distant relatives, there is no one who uses drugs or opium. That is, this desire does not exist inherently. It's not that I or we are good people. No, it's that this desire simply doesn't exist. Maybe even if there were a whole bag of opium here, I would have no interest in it and it would hold no appeal for me. But this same opium might be attractive to some people, and there might be an inner desire that draws them toward it. Alright, now let's get to the issue where people say opium isn't harmful and doesn't cause any problems. Opium causes heart damage through 4 different pathways. The first is hypoxia. That is, opium leads to a decrease in the oxygen circulating in the blood, and as a result, the amount of oxygen reaching the heart also decreases. Therefore, cardiovascular complications increase. 2. Opium causes the body's inflammatory system to become abnormally activated. This means that the levels of inflammatory cytokines and interleukins in the blood increase, and these themselves are also harmful. The third pathway is disruption of fat metabolism. People who use opium have lower levels of good blood fat, or HDL, and for this reason, they are at higher risk for cardiovascular strokes. The fourth pathway is the prolongation of the QT interval. This means that a disturbance appears on the ECG, which makes them prone to cardiac arrhythmias, and these cardiac arrhythmias can lead to sudden death. That's why you've often heard that someone who uses opium or is at a gathering has suffered a seizure and cardiac arrest. Now, let's return to our own society and the studies that have been conducted to see what the statistics say. According to recent research, the regular use of opium significantly triples the risk of experiencing a heart attack. In other words, it lowers the age at which heart attacks occur. That's why both studies have shown, and in practice we often see in hospitals, that opium users have heart attacks at a younger age. Statistics show that the average age of heart attack in our society is 62 years. But in opium users, it's 48 years old, meaning someone who uses opium has a heart attack 14 years earlier than others. Here, a question arises. When we tell many people not to use opium because it's harmful to their heart, they say, "My grandfather is 90 years old, and he also uses opium. He's healthier than I am right now. So what's the reason for this?" The reason is that when we say opium increases the risk of heart attack and sudden death, it doesn't mean that everyone who uses opium will die, or that everyone who uses opium will have a heart attack. This is statistics, this is probability. It means the likelihood of a heart attack goes up. Imagine if the chance of a heart attack in the general population is 2%. For someone who uses opium, it becomes 3 times higher. That means it becomes 6%. So still, more than 90% of people who use opium do not experience heart attacks or sudden death. Therefore, your grandfather might be among those people, or maybe your grandfather actually has some protective genes. He might have certain physical characteristics or some factors that make him resistant to the side effects of opium. But that's not the case for everyone. For you, this might not happen. You might lose your life at the age of 40 because of using opium. So don't always look for exceptions. Follow scientific rules. Follow what research has proven, and research, statistics, and figures have all shown that opium has harmful effects. It increases the risk of heart attacks. It increases the risk of sudden death. It increases arrhythmia. So you should take that into account and use it as the basis for your judgment. The next issue I encounter is that when we tell the patient, "Dear, don't use opium," they say, "Doctor, don't worry, I get my opium from a reliable source. I use pure opium. My opium isn't mixed with anything. It's 100% pure, and we even had a case just last week. When I told him not to use opium, he came forward, winked, and actually raised his eyebrow. He showed me a picture of someone on his phone. He said, "Doctor, I get my opium from here," referring to one of the country's officials. "My opium is safe, don't worry, and it doesn't cause me any problems." So, what answer do we have for this? The point is, the side effects we've mentioned are related to that same pure opium. In other words, the opium itself is the problem. Even if we assume it's 100% pure, 100% unadulterated, it still has the side effects we've mentioned. It can lead to death. It can cause a stroke. If it's adulterated, the situation will be even worse. The side effects it causes will be much greater. Now, what kinds of things might be mixed into opium? Many of those who are so-called dealers, many of those who sell opium in order to keep their clients, or rather patients and customers, permanently dependent on them, add certain psychoactive substances to their opium. This causes the individual's dependence or the patient's dependence on the dealer to increase. The next harmful substance they add is lead. When they add lead to opium, it makes the opium heavier and also gives it a more attractive color. It becomes more visually appealing and glossy. It becomes more appealing to customers. The next harmful substance is copper. Copper is also a substance that, when added to opium, increases the pleasure of smoking opium, and that's why when a person uses opium, they feel euphoric. It gives a strong kick, and this leads to dependence on the dealer. It causes dependence on the source that supplies the opium. But all these additives, or all these substances we've mentioned that are mixed in, double the side effects of opium. They can lead to sudden death. They can cause blood to clot in the body's veins. The person may develop a pulmonary embolism. The person may have a heart attack. So opium itself is harmful, it has side effects, it causes cardiovascular problems, and if it's mixed with other substances, it's even worse, and its side effects will be much greater. So my dear, don't use opium, whether it's mixed or not, whether it's pure or impure. Interestingly, in this regard, a study was conducted in Mashhad, and they found that 60% of street opium is mixed with other substances, either with lead or other heavy metals and dangerous substances. The next point is the method of opium consumption. Many people tell us that they mix opium with tea or brew it and then consume it, so they think it doesn't have many side effects. This is also a misconception. All forms of opium consumption are harmful, whether it's ingested, inhaled, or injected into the vein. However, the rate of cardiovascular complications is highest in those who smoke opium, and these complications also appear more quickly. Among those who inject opium, the risk of heart infections, heart valve infections, or what is known as endocarditis, is higher, and they may need to undergo open heart surgery or have their heart valves replaced at a young age. Therefore, the method of consuming opium does not reduce its harm, and there is no guarantee for the health of the heart or mind. The next question people ask us is opium more harmful or cigarettes? Because many of our patients who have had a heart attack after they are treated and come back to us are still using both cigarettes and opium, as well as many other things. And then they come and say, "Doctor, should we quit cigarettes or opium? Which one should we quit? What is your opinion?" We should put it this way. Cigarettes are harmful and opium is also harmful. In other words, opium is bad, but cigarettes are worse. But the difference is that cigarettes affect the heart's arteries gradually and slowly. But with opium use, this issue happens suddenly. That means a person can suddenly suffer a heart attack, cardiac arrest, or a pulmonary embolism. Now, after these explanations, you might ask whether opium is entirely harmful and has no beneficial effects at all. Actually, opium does have some limited beneficial effects. That is, in the short term, it can lower both heart rate and blood pressure and reduce anxiety to some extent. But all of these effects are short-term and temporary. On the other hand, opium is a strong painkiller and can relieve various types of pain in the body, whether it's muscle pain, heart pain, or any other pain a person may have. That's why we use the active ingredient in opium, which is morphine, quite a lot in medicine. There are also some misconceptions about this topic. For example, many people think that because opium is bitter, it leads to a reduction in diabetes and blood sugar. However, studies have shown that opium actually increases 3-month blood sugar levels and also worsens the complications caused by high blood sugar. And some people think that if they use opium, they are less likely to get lung infections, or even if you remember during the COVID pandemic, people used to say that opium users wouldn't catch COVID. However, studies showed that opium users were actually admitted to the ICU and special care units more often than others. And as a final word, dear friend who uses opium, or if you have someone in your family who uses drugs, the ultimate effect of opium is that it shortens life expectancy. It can lead to heart attacks, cardiac arrest, pulmonary embolism, and heart arrhythmias. So before it's too late, quit opium. Thank you.